Depression is a serious mental health condition that affects millions of people around the world. It can cause significant emotional and physical distress, impair daily functioning, and increase the risk of suicide. Identifying depression early is crucial for effective treatment and better outcomes. In this video, we will discuss the use of screening tools in identifying depression. We will explore the benefits and limitations of these tools, the different types of screening tools available, and how they are used in various settings. By the end of this video, you will have a better understanding of the importance of early identification of depression and the role of screening tools in achieving this goal. 1. Screening tools are commonly used to identify depression in various settings, such as primary care, mental health clinics, and schools. Screening tools are designed to quickly and easily assess symptoms of depression in individuals and are widely used in various healthcare settings to identify those who may need further evaluation or treatment. These tools can be useful in identifying depression early and can lead to better outcomes for those experiencing symptoms. 2. These tools are designed to quickly and easily assess symptoms of depression, such as feelings of sadness, loss of interest, changes in appetite or sleep patterns, and thoughts of suicide. Screening tools are specifically designed to quickly and easily assess symptoms of depression in individuals. These tools typically include a series of questions that can help identify common symptoms of depression, such as feelings of sadness or hopelessness, loss of interest in activities, changes in appetite or sleep patterns, and thoughts of suicide. By evaluating these symptoms, healthcare professionals can quickly identify individuals who may be at risk for depression and in need of further evaluation or treatment. 3. Some commonly used screening tools for depression include the Patient Health Questionnaire, PHQ-9, the Beck Depression Inventory, BDI, and the Hospital Anxiety and Depression Scale, HADS. The Patient Health Questionnaire, PHQ-9, the Beck Depression Inventory, BDI, and the Hospital Anxiety and Depression Scale, HADS, are among the most commonly used screening tools for depression. These tools are designed to be simple and quick to administer, and they can help healthcare professionals assess symptoms of depression in individuals across a range of settings. Each of these screening tools has its unique features and can be used in different ways depending on the needs of the individual being evaluated. 4. Screening tools are not meant to diagnose depression but to identify individuals who may be at risk for depression and in need of further evaluation. It's important to note that screening tools are not designed to provide a definitive diagnosis of depression. Rather, they are used to identify individuals who may be at risk for depression and in need of further evaluation by a healthcare professional. Once identified, individuals who show signs of depression can be referred for a more in-depth evaluation to determine whether they have depression or another mental health condition. By identifying individuals at risk early on, healthcare professionals can provide appropriate treatment and support to help individuals manage their symptoms and improve their overall quality of life. 5. Screening tools are usually self-administered questionnaires that take only a few minutes to complete. Screening tools for depression are usually self-administered questionnaires that take only a few minutes to complete. These questionnaires typically consist of a series of questions that are designed to assess a person's symptoms of depression. The questions may ask about the individual's mood, energy level, sleep patterns, appetite, and other factors that can be associated with depression. Because they are quick and easy to administer, screening tools can be used in a wide range of settings, such as primary care clinics, mental health clinics, and schools. 6. The results of screening tools should be interpreted by a trained healthcare professional, such as a physician, nurse, or mental health provider. While screening tools for depression can provide valuable information about an individual's mental health, it's important to remember that the results should always be interpreted by a trained healthcare professional. This can include a physician, nurse, or mental health provider who is trained in evaluating and diagnosing mental health conditions. These professionals can provide a more in-depth evaluation of an individual's symptoms and determine whether a diagnosis of depression or another mental health condition is warranted. Additionally, they can work with individuals to develop a personalized treatment plan that may include therapy, medication, lifestyle changes, or other interventions to manage their symptoms and improve their overall quality of life. 7. The use of screening tools can help healthcare providers identify depression early, leading to earlier treatment and better outcomes. The use of screening tools can help healthcare providers identify depression early, which can lead to earlier treatment and better outcomes for individuals who are experiencing symptoms. Early identification and treatment of depression can help prevent the condition from worsening and can improve an individual's overall quality of life. By using screening tools to identify individuals who may be at risk for depression, healthcare providers can take proactive steps to provide appropriate treatment and support to help manage their symptoms. This may include therapy, medication, lifestyle changes, or other interventions that can help individuals recover and lead fulfilling lives. 8. Screening tools can also help healthcare providers monitor symptoms over time and adjust treatment plans as needed. In addition to identifying depression early, screening tools can also be used to monitor symptoms over time and adjust treatment plans as needed. This can help healthcare providers evaluate the effectiveness of treatment and make any necessary changes to ensure that individuals are receiving the best possible care. By tracking symptoms and adjusting treatment plans, healthcare providers can help individuals manage their depression and improve their quality of life over time. Regular screening can also be useful in identifying any potential relapses or changes in symptoms that may require additional treatment or support. Overall, the use of screening tools can be an important part of managing depression and ensuring that individuals receive the best possible care. 9. It is important to note that screening tools may not be effective for everyone, and some individuals may require a more in-depth evaluation to accurately diagnose depression. While screening tools can be a useful tool in identifying depression, it's important to note that they may not be effective for everyone, and some individuals may require a more in-depth evaluation to accurately diagnose depression. In some cases, individuals may not exhibit clear symptoms of depression or may have symptoms that are difficult to identify using a screening tool. In such cases, a more comprehensive evaluation, which may include a detailed medical and mental health history, physical examination, laboratory tests, and a mental health assessment, may be necessary to determine whether an individual has depression or another mental health condition. It's important for healthcare providers to use their clinical judgment when interpreting the results of a screening tool and to consider other factors, such as an individual's medical history and other risk factors, when making a diagnosis or treatment plan. 10. Screening tools should be used as part of a comprehensive approach to identifying and treating depression, which may include medication, therapy, lifestyle changes, and support from family and friends. Screening tools are just one part of a comprehensive approach to identifying and treating depression. In addition to screening, healthcare providers may use a variety of approaches to help individuals manage their depression, including medication, therapy, lifestyle changes, and support from family and friends. Medication can be used to help manage the symptoms of depression and is often prescribed in conjunction with therapy. Therapy can be an effective way to help individuals learn new coping skills and develop strategies for managing their symptoms. Lifestyle changes, such as regular exercise, healthy eating, and stress reduction techniques, can also be effective in managing depression symptoms. It's important to note that social support can also be an important part of managing depression. Family and friends can provide emotional support and encouragement to individuals who are experiencing depression, and can also help with practical tasks, such as meal preparation or transportation to appointments. In some cases, support groups or peer counseling may also be helpful. Overall, a comprehensive approach that includes screening, medication, therapy, lifestyle changes, and support from family and friends can be an effective way to manage depression and improve an individual's quality of life. In conclusion, screening tools are an important tool in identifying depression and ensuring that individuals receive the appropriate care they need. While screening tools are not a definitive diagnosis, they can provide valuable insights into an individual's mental health and help healthcare providers develop effective treatment plans. If you are experiencing symptoms of depression, it is important to seek help from a trained healthcare professional. With early identification and treatment, individuals can recover and live fulfilling lives. Thank you for watching, and we hope this video has provided valuable information on the use of screening tools in identifying depression.